Hi, I'm Samantha Cristelli, nurse practitioner at Pima Heart and Vascular, specializing in structural heart disease in the office setting.
And I'm Sydney Burke, nurse practitioner of Pima Heart and Vascular, specializing in structural heart disease in the hospital setting.
We'd like to talk to you today about heart failure, also known as CHF, which is a progressive heart disease that affects 64 million patients worldwide and is the leading cause of hospitalizations in the world.
For those unfamiliar with CHF, it's a disease of which the heart cannot pump blood properly. Sam, what are some of the symptoms that CHF patients might express in the clinic?
So the main symptom that patients come in and complain of is shortness of breath. Shortness of breath at rest and with exertion that affects their activities of daily living, such as walking to the mailbox, walking upstairs, folding laundry, as well as making their bed. They also experience severe fatigue and weakness, as well as swelling in the lower extremities, the feet, the ankles, and sometimes the belly. Sydney, what are the types of symptoms that you see in the acutely ill CHF patients in the hospital?
Whenever patients come into the hospital, I notice that they have worsening shortness of breath on exertion and while at rest, sometimes requiring oxygenation. They also have severe swelling in their abdomen and their lower extremities, and they also complain of shortness of breath while laying flat. Patients also report significant weight gain over the course of several days. Now, while these are severe CHF symptoms, we typically like to treat these patients with medical therapy in the clinic setting prior to symptoms becoming this bad.
Unfortunately, despite the initiation of significant lifestyle changes such as increasing exercise and changes in diet, as well as a complex medication regimen available for management of heart failure, many heart failure patients are left without options for symptom relief.
In this setting, we are excited that Pima Heart and Vascular has the opportunity to explore the potential of percutaneous left atrial decompression to give these patients a chance at a better quality of life with enrollment in the investigational ALLAY heart failure study.
The ALLAY heart failure study targets patients with chronic heart failure and preserved ejection fraction or mildly reduced ejection fraction who remain symptomatic despite appropriate guideline-directed medical therapy. Let's take a closer look at the new technology that may have the potential to change patients' lives.
Hello, I'm Dr. Thomas Wagner, Medical Director of Pima Heart and Vascular's research program. We are excited to bring you new technology in the form of a device called the ALLAY-HF device, which creates a small shunt between the left atrium and the right atrium with a 7mm hole. This reduces pressures on the left side of the heart to allow you to breathe better and reduce congestive heart failure. This new investigational device creates an intra-atrial shunt to reduce those pressures. Clinical trials allow opportunities for different folks to feel better. We feel this device will lower the pressures in the heart without an implant. We're excited to bring this technology and therapy to the greater Southern Arizona region, particularly our patients here in Tucson. The investigational ALLAY-HF device is intended to relieve pressure buildup in patients who have diastolic heart failure. A small catheter is placed into the vein in the groin and passed into the heart over a guide wire. Once inside the heart, we create a small hole between the intra-atrial septum, which is essentially the wall that separates the right and left sides of the heart at the atrial level. This device then creates a small 7mm hole by removing a short piece of tissue. The tissue is removed. The guide wire and catheter are then subsequently removed from the body. This tissue is removed using a short pulse of energy, creating a small, durable passageway between the atrium. This then creates an offloading of the left side, which is high pressure, to reduce pressure to a lower-sided, right-sided chamber, reducing the pressures on the left side in diastolic heart failure. The hole is a permanent hole that does not require an implant. The benefits of participating in this trial is it allows the patients to be monitored and their condition to be monitored closely by a team of specialists. The study-related care team is acutely involved in monitoring outcomes up to 5 years in this clinical trial. Heart failure in general is one of the largest hospital admissions in the US by and large. Opportunity to help advance new technology and bring new therapies is paramount to this space. If you or a loved one is impacted by diastolic congestive heart failure, please learn more at pimaheartandvascular.com.